I'm joined by State Health Officer Dr. Scott Harris. As of this morning, 538 people in Alabama have been diagnosed. 3 Alabamians have passed due to complications. I cannot stress to you enough the fact that we must be serious about eliminating the spread of this deadly virus. Folks, this is real. It is very real. And I want to assure you that I'm doing everything in my power and using every available resource. We must protect the people of Alabama. On March 6, I set up a coronavirus task force of state leaders and health experts. I asked Dr. Scott Harris to chair that task force and be the spokesman for the information for the public on this issue. He's done an outstanding job, and he's done it in a difficult and unprecedented time. On March the 13th, before we even had a case in Alabama, I issued a state of emergency because we knew Alabama would not be shielded from the COVID-19 virus. We enacted social distancing guidelines to limit 25 people or less from congregating, and took the added step for restaurants to be limited to takeout or delivery only. This was done first in Jefferson County, but shortly thereafter we applied it statewide. Under the authority granted me during the state of the emergency, I moved the primary runoff election to July 14th in order to protect our poll workers and to guarantee our students, our citizens, that they can feel free and safe when they cast their vote. Working in concert with Dr. Eric Mackey, Superintendent of Schools, I issued an order that would close our schools until April 6 to protect our students and teachers. I also closed Alabama's beaches, prohibited visitation to assisted living centers and nursing homes, and provided special guidelines for child care centers. Last week, I authorized Adjutant General Cheryl Gordon with the Alabama National Guard to activate up to 100 guardsmen, and I will soon be putting their first unit to work. My team has moved the tax filing date to the new federal filing date of July 15. We've also announced that anyone who loses a job because of coronavirus will have the potential to receive unemployment compensation. And just yesterday, I announced with Dr. Mackey that when school resumes on April 6, instead of returning to a traditional classroom, students will be allowed to work from home while maintaining their academic instruction. Folks, this is a quick snapshot of how my administration is responding to this deadly virus. As I've said before, we're going to make our share of mistakes along the way. But you can count on this. We are not going to be accused of not making difficult decisions, nor are we going to be accused from offering criticism with no solutions. As you know, this pandemic is a global crisis, but it's not something that cannot be managed. We will use a measured and balanced approach to address this crisis. Unfortunately, there is no instruction manual on how to do this. Yes, it will be hard, but I am more confident than ever that we will get through this together. That's why, from this point forward, I want all of us to think of this as Together Alabama. And as we do everything humanly possible to ensure that we have adequate equipment to fight this virus and to communicate the urgency to stay at home as much as possible, I also have to keep my eye on the economy. A lot of people out there probably know I was a former teacher, but you may not know that I was also an economics teacher. So as governor, I have made our economy and workforce development a real priority. Like you, I know we will certainly be dealing with the fallout of COVID-19 in the areas of health and our economy, and both of these weigh heavily on my mind. Each day, we watch the coronavirus spread throughout our state with one new report after another. You've heard me say we aren't California, we are not New York. But Grove Hill is not Gadsden, and Decatur is not Dothan. That's why I support our mayors throughout the state that feel they need to take additional steps if their situation on the ground warrants it. But I have a responsibility to look statewide, and in this case, one size does not fit all. My word of caution to those who want to take a more direct action is this: government can choke businesses. We do it every day with regulation and bureaucracy. But folks, if we kill businesses, we can't print enough money in Washington, D.C. to bring a dead business back to life. Clearly, we have our own unique set of circumstances in our state that we must rise to the task to meet. So rather than shutting the entire state down, I propose a different solution. Today, I join Dr. Harris in announcing a specific list of businesses that will be closed until April 17. I do not believe our economy needs a full shelter-in-place order, as some other states have done, not at this time, and hopefully not ever. However, I do believe limiting social gatherings as much as possible will be the best way we can combat this virus. And if people want to do more individually by imposing your own shelter in place, you don't need my permission to do so. This decision has not been made lightly, but it has been made with a tremendous amount of concern and discussion. Places where people closely interact with each other and often touch one another will need to temporarily shut their doors. Places like nail salons, day spas, barbershops, gyms, fitness centers, bowling alleys, and concert venues. Folks, this is incredibly disappointing news to deliver, but this is a matter of life and death. So if you can stay at home, you are safer at home. And if you choose to stay at home, this doesn't mean inviting your friends over. This means be isolated, stay at home. I want the people of Alabama to know that the struggles of losing a job and trying to find a way to pay a mortgage on a home is not lost on me or my administration. Yesterday, Julie from Mobile called my office. She explained that she'd worked every day of her life since she was 15 years old. Julie currently works in our family restaurant, which has been closed. Her husband worked in a hospital, and since we are currently asking medical providers to not perform elective surgeries and procedures, he has been sent home. She explained the burden she faced in her finances the next few months. She said, "I don't want a handout, but I do need some help." Her story is just one of many that I know of, and I know a lot of people in our state are facing this same kind of burden. So to Julie and all the others in our state, I'm going to do everything in my power to help you and all of the people of our state get through this difficult time. You have my word. Now I'd like to ask Dr. Harris to come and speak to us for a few minutes. Dr. Harris.
Thank you, Governor. Thank you very much. We appreciate you joining us today. I want to just go over the items that we are going to include in a new statewide health order that's being issued today. The The terms of this will become effective at 5 p.m. tomorrow, March 28th, and will extend through April 17th, which is a Friday at 5 p.m. We have several of the orders that are similar to those that were in our initial order last week, but I'll go through these and take a few minutes and try to cover these items with you. And I know we're going to have some questions to answer on these a little bit later. Effective March 28th at 5 p.m., all non-work related gatherings of 10 persons or more, or non-work related gatherings of any size that cannot maintain a consistent 6-foot distance between persons are prohibited. Employers shall take all reasonable steps to meet these standards for employees and customers. We initially had a health order related to gatherings of 25 or more, consistent with what the President has said and with what we have gotten from CDC. We have changed that to 10 persons or more. Effective March 28th at 5 p.m., the following non-essential businesses, venues, and activities shall be closed to non-employees or shall not take place. We have 4 categories, including entertainment, athletic facilities, close contact services, and retail, and I'm going to list those for you now. Entertainment venues, including nightclubs, bowling alleys, arcades, concert venues, theaters, auditoriums, and performing arts centers. Tourist attractions, including museums and planetariums, racetracks, indoor children's play areas, adult entertainment venues, casinos, bingo halls, venues operated by social clubs. Athletic facilities and activities, including fitness centers and commercial gyms, spas and public or commercial swimming pools, yoga, bar or spin facilities, spectator sports, sports that involve interaction with another person of closer than 6 feet, activities that require use of shared sporting apparatus and equipment, activities on commercial or public playground equipment. Close contact service providers, including barbershops, hair salons, waxing salons, threading salons, nail salons and spas, body art facilities and tattoo services, tanning salons, massage therapy establishments, and massage services. Retail stores, including furniture and home furnishing stores, clothing, shoe and clothing accessory stores, jewelry, luggage, and leather goods stores, department stores, books, craft, and music stores, and sporting goods stores. We've been asked specifically about gun stores. Gun stores are not included under retail. Individual gun stores are not included under retail for the purposes of this section. There are a number of businesses that are not on the list. Those that are not on the list are not required to be closed to non-employees, but employers should take all reasonable steps to meet those standards of social distancing and hygiene that we have mentioned before. Much of the rest of the order is similar to what has been previously announced. The beaches shall remain closed through the end of this health order, April 17th. The same status applies to senior citizen centers, to all schools, public and private, including elementary, secondary, post-secondary, technical, and specialty schools, and colleges and universities. Facilities providing daycare have health orders that are unchanged from our previous order last week. I certainly understand that this order temporarily affects the changes that have been made in Jefferson County. They had somewhat more stringent daycare orders, and they are certainly free to reinstate those at their discretion after we have conferred on this. Hospitals, nursing homes, and long-term care facilities will continue to prohibit visitation, except in certain situations. All dental, medical, and surgical procedures shall be postponed until further notice. We have a section in here on clarification of that. We've had a number of questions on what exactly is elective and not. We do not have an established list of what is elective and what is not elective, and we don't have blanket authorization given to any kind of facility, but we have added detail here so that that will be able to be determined in the clinical judgment of a provider who's performing these services. We continue to have the same health orders as they apply to restaurants, bars, breweries, and similar establishments, which will continue through April 17th. There are some possibilities of receiving exemptions from those that are similar to our previous health order, And for now, this order supersedes and preempts all the other orders through Mobile County and Jefferson County, although those counties are certainly free to add their own more stringent measures if deemed necessary with their health officers and their own local boards of health. These are the main issues, or the main items contained in the health order today, and I'll turn it back over to Governor Ivey.
All right, so we're going to take a few questions that reporters have sent over, and the first one is for the governor, and it is from Lydia Nussbaum with WSFA. She asks, how are you going to determine non-essential versus essential? What is the criteria to determine this?
That's a good question, and I'm sure it's one that a lot of people have. We're designating 4 categories of non-essential businesses, and each category further specifies subcategories of businesses that will be closed. So unlike other states, we have not tried to say what is essential. We're simply designating what is non-essential. If it's not on the list, it's not closed.
And Governor, also for you, as a follow-up to that, this is from Kim Chandler with the Associated Press. How did you decide which businesses to include in the order?
If the business involves the operators or customers being closely with each other and touching one another, they're highly likely to transmit the virus because they just have to touch you in some of these businesses. However, we've been working closely with Dr. Harris and his team and other medical experts, so let me invite Dr. Harris back up for any comments he'd like to make.
Thank you, Governor. It is in a way somewhat of a decision that creates, winners and losers in a sense. We do have to make some difficult decisions about what we would consider to be essential and non-essential. Honestly, I'm not entirely comfortable with that term because all these businesses are things that are part of our everyday lives and part of the things we all need and participate in, and certainly the people who do those jobs every day are not people who are not essential. So that's a legal term that I wish we had a better phrase for. But we looked very carefully at what other states had done. We've looked closely and tried to decide in what type of environments transmission of disease would be more likely to occur. And so, as I mentioned, in some point, it's always going to be seen a little bit as arbitrary, but based on the best information we have, we felt like this was the most comprehensive list that we could get to balance between keeping people working, but also making sure we protected everyone and kept them safe.
Governor, we've got another question for you. This is from Karen Goldsmith with Alabama Public Television. And she asks, how many unemployment claims do you anticipate?
Well, first and foremost, these are certainly unprecedented times, and there's just no way that we can forecast at this time how many that will be. I know that the Department of Labor is working overtime and around the clock to process the many, many claims that are coming in. And the federal dollars that we anticipate, however, will alleviate the state's burden. But simply put, it's just too early to tell.
Governor, this is from Alan Collins with WBRC. What are the penalties for violation of these closures?
The penalties are punishable by a fine of up to $500 per violation, and we'll also rely on the guidance of Attorney General Steve Marshall. I just urge all Alabamians to heed the warnings. Every Alabamian can social distance. Every Alabamian can wash your hands for 20 seconds thoroughly. Every Alabamian can take responsibility for yourself and for members of your family.
And Governor, another question. This is from Caroline Beck with Alabama Daily News. What left is there to shut down after this? It seems that most retail stores and services will be shut down after this, except for grocery stores, pharmacies, and hospitals. So why not put a shelter-in-place order for the state?
Well, this is not a decision I came to lightly, but you have to consider other factors, such as the importance of keeping businesses and companies open and the economy going as much as possible. When a business closed down, it's very, very almost impossible to bring it back to life. So Alabamians, we can do our part, and I think if we all do our part through April 17th, we'll see a situation much improved.
Governor Tim Lockett with the Anniston Star, he asked, any estimate of how many workers will be affected?
And that's hard to tell, but we're going to do our best to protect everyone. But the intention is keeping the economy going and protect the well-being of all Alabamians, and we'll continue to do that.
Governor Ivey, this is from Brian Lyman with the Montgomery Advertiser. House Speaker Mac McCutcheon said yesterday he believed the legislature would consider an extension of unemployment benefits from the current 14 to 20 weeks to 26 weeks. Given the rise in unemployment claims that we are seeing, would you be in favor of this approach?
Well, certainly I'll be open to all options and look forward to those discussions, but at the same time, what's the law now is the law, but I do appreciate the legislature being aware of this possibility, and I look forward to working with them.
And Governor Ivey, a question from Rashad Hudson with CBS 42 and Nexstar Media. Do you have a response to the Lieutenant Governor's recently issued memo?
As a public official, our greatest responsibility is to be honest with one another and to the people of Alabama. I invited Lieutenant Governor Amesworth to be on my task force because he said he was willing to help and wanted to help. What is not helpful is raising challenges and criticisms and issues that we're already aware of, but offering no solution and showing no willingness to work with the task force, the team that's trying to fix it.
Dr. Harris, a question for you. This is from Kip Rayleigh with Fox 10. Are open air places like golf courses, state parks, etc. included in the closures?
The only ones included in the closures are the ones that we specifically listed. Open air activities certainly are open as long as they can adhere to the other parts of the health order, including limits on the number of people gathering. So, for example, I certainly would expect a golf course would be open. There may be situations where 10 or more people would be gathered at a golf course in an environment, and that would be covered by the order. But as long as people can maintain appropriate social distancing and be aware of those numbers that are included, then those open air venues would certainly be open.
Dr. Harris, this is from Andrew James with Alabama News Center. Have any of the confirmed cases put large groups of people at risk of exposure? Example, retail workers, food workers, first responders, grocery store employees, factory employees. If so, will the public be notified of those cases? What is the state's protocol for notifying people who may have been exposed?
Sure. So this is part of the normal epidemiology that public health does all the time. We have a number of diseases that in our state are reported to public health and that we investigate, and that we will contact a person who has a certain type of infection and find out what their daily activities are and who is in their household and who's in their workplace, and try to make sure that we reach contacts. And we continue to do this with COVID-19. There have been cases that have existed in workplaces. I know the media has reported a few of them already, and that's certainly not surprising given the number of cases that we're beginning to see now. And so in each one of those cases, our epidemiology staff is aware of that case and has spoken with that person and has reached out to get in touch with those people who may have been considered contacts or may be at risk.
All right, and Dr. Harris, this is from Henry Thornton with Yellowhammer News. How, in effect, are the measures introduced today different from a shelter-in-place order?
I think it's sort of, I would say the intent of this is similar to maybe what a shelter-in-place is, in that it's not coercive, it's not literally a shelter-in-place, but we're trying to emphasize the importance of people to stay home and stay away from crowds. We want people to take this seriously. We want people to stay home whenever possible. As Governor Ivey said, this is not a time to stay home with a big crowd of other people. This is a time to stay home and isolate yourself to every extent possible.
Dr. Harris, from Chip Brownlee with Alabama Political Reporter. How many people are currently hospitalized in the state? How many of those are in ICUs?
I'll give you the latest numbers I had from this morning. At the moment, we have somewhere just under 550 cases that have been confirmed so far. A little over 10% of those cases are hospitalized in the state, and of that number, half of those who are hospitalized are in ICUs, and about a third of those actually are on mechanical ventilation. So we will continue to get additional numbers as testing ramps up. We're certainly aware of additional hospitalized cases that are awaiting on testing and awaiting confirmation. I believe the percentage that are hospitalized is actually higher than that, as I mentioned on the call yesterday. So we will release that information just as soon as we get it, but certainly at least 10% are hospitalized.
And Dr. Harris, also from Chip Brownlee with Alabama Political Reporter, are you concerned that Alabama's case count is growing faster than larger states like Florida and Georgia?
Yes, I am. I think that part of it has to do with our rollout of testing, and we have sort of increased at an increasing rate how much testing capacity we have. So as we test more and more places, we do find larger numbers that show up quickly. At the same time, I think we believe there is disease transmission going on and that there are more people becoming infected.
Dr. Harris, from Andrew Yeager with WBHM, how are hospitalization rates being calculated? You said yesterday that the hospitalization rate is about 8%, but UAB said yesterday they alone had 62 patients with about 500 confirmed cases Thursday. That's well above an 8% rate.
Right. Yeah, that goes to the discussion we had in the press conference yesterday about how we actually count them. It's kind of a dry discussion in a way, but we have very specific definitions for how we count patients, and we have to do some confirmatory processes to make sure that they meet our definition in a way so that we know that we're giving accurate numbers and so that we can compare our numbers with other states or even with other countries. So I don't have any reason to doubt those numbers from UAB. I certainly, as I said, think we do have a higher percentage of people who are hospitalized, and they are working through some processes with us and with FDA to make sure that we can get those definitions met so that we can report that information even more accurately.
Dr. Harris, from Brian Lyman with the Montgomery Advertiser, the New York Times Friday morning reported on per capita testing by state. Alabama was one of 7 states where it could not return data, quote, because there is inconsistency in the data. Many of them report only positive results, making it hard to know the total number tested, end quote. Widespread testing and isolation of those who test positive appear to be the best method of containing the virus. Does public health have any statistics on the total number of tests administered in the state to this point, and specifically our testing per capita? Are we close to being allowing non-symptomatic patients to get tested, and when would you anticipate that happening?
Okay, that's several questions there. Let me try to take them one at a time. We are reporting to the best of our ability the number of tests that are being performed. We are very comfortable that we're capturing all of the positive tests. Because there are several other organizations and commercial facilities that are doing testing, they are required to report to us through our emergency rule we passed a few weeks ago, all of the negative tests as well. The negative tests don't come in real time in quite the same way, just because it's an electronic reporting process that they've not had to do before relative to this disease, since this wasn't being reported before. It's somewhat of a manual process for us to make sure that we have all of those negative tests in the totals, and so we update those and try to keep those as accurate as possible. I think as we continue into this, that'll be a lot more streamlined and automated, and we'll be able to give you a better picture of our total rate of positives over the total number of people tested. I think we think it would be great to have large numbers of people tested if possible to get some idea of what the background prevalence or the background rate of infection is in the community. But at this time, we do not have the capacity to do that, and most states do not have the capacity to do that. So as we continue to expand our capacity, we will certainly consider doing that if possible. Right now, we certainly don't recommend that asymptomatic people be screened. We still think it's important to contact a provider if you feel like you need to be screened. Have a conversation with the provider who knows you. If you don't have a provider, then we have mechanisms in place to get you connected with someone who can advise you. And then if you have symptoms and your provider feels it would be appropriate, then we will make sure that test gets done for anyone who needs one.
Dr. Harris, from Kim Chandler with the Associated Press, how many deaths in the state are being investigated now as possibly coronavirus related?
We have 3 deaths that we have posted on the website. We have a handful more, and I think the total is about 8, but that changes a little bit from minute to minute that we're investigating. The reason it takes a few moments to get that information out is that we need to actually confirm that the death is related to COVID-19. It's certainly possible for someone to die of a different cause, and yet perhaps they've had a positive test at some point, and so we want to make sure we're giving accurate information. It's possible that the suspected deaths number could go down as we get new information and confirm things, but right now we have about 8 or so that we're investigating.
Dr. Harris, this is from John Sharp with AL.com. Tuscaloosa has instituted a 24-hour curfew to April 11th. Birmingham council members passed shelter-in-place ordinance, and Mobile Mayor Sandy Stimpson indicated that what is going on in Mobile is different than what is going on in other places of the state. Can you clarify the authority leaders in cities, big or small, have toward doing certain things to protect their communities throughout the duration of this pandemic? In the rural areas, what authorities do counties have?
Sure, that's a great question. With a statewide health order, what we hope to do is sort of at least set the floor for what everyone ought to be doing. These ought to be health orders that everyone accepts, and in those counties that have their own independent boards of health and their own county health officers, they're certainly free to adopt more stringent orders if they would like. Well, I think certainly each individual community, their leadership knows best what fits in that community, and for any more stringent measures they want to enact, we would certainly be supportive of that.
And that wraps up the questions that we have today, so Governor Ivey, you can close us out.
As you can tell, this is a very, very serious virus that we're all facing. And folks, I just plead with you, take individual responsibility for yourself and for your family. And if you can stay at home, please do so. Truly, this is an Alabama family situation. So remember our theme, Together, Alabama. Together, Alabama, we will get through this. May God continue to bless each of you and the great state of Alabama.